Welcome to the Leading Real Change podcast. I'm your host, Dr. Jacqueline Kerr, an expert in workplace culture change. From my unique background in behavior science, public health, and community advocacy, I help corporate leaders with evidence-based individual, team, and organizational change to create thriving workplace cultures for all. In the Leading Real Change podcast, I interview dedicated and passionate change makers about their careers, how they lead change, and what leaders can do today to make a difference, to build healthy, inclusive workplace cultures for all. I'm excited to share these examples of real workplace change with you. You'll learn about effective strategies that are working and how to overcome real barriers to change that challenge us every day. I hope you'll feel inspired and more confident to keep leading change in your workplace. Please share this podcast with other HR, DEI, or ERG leaders who you know are working hard but are struggling to have an impact and need more support to effectively create a thriving workplace culture for all today.
My name is Stephanie Mercado. I'm the CEO of the National Association for Healthcare Equality. I've been in my current role for approximately 9 years, and I have a full family life as well. I have been married to my husband for 20 years and have two very active boys who are both in travel hockey. One of them is in 7th grade and the other is in 3rd grade. And we have a great puppy that we got during COVID, who I enjoy a lot.
That's great to hear. So many people got puppies during COVID, and I'm glad if the transition goes well. I have a friend whose dog's anxious because it's not used to having them around. Interesting transitions we had as families. So yeah, let's start with your own career journey. And how has motherhood or burnout or both impacted it?
So I have been working professionally for over 20 years. I started really focused in the marketing, communications, and public relations discipline. And that was really because I love to take complex topics and distill them down into digestible pieces of information and use information and stories to create change. I then began my work in the nonprofit membership association space in 2002. And I was working for medical specialty societies and had a lot of different roles in those organizations, supporting membership, supporting marketing and communications, public relations, fundraising, product development for education, and much more. And took the opportunity to come to NACU to really get exposure to the back of the house of healthcare. When I first started off, all the clinical experiences were very beneficial, but I could see that healthcare was really shifting fundamentally, and that the administrative roles were really starting to drive a lot of what was going on in healthcare and quality. I took the shift to work at NACU about 9 years ago and have been really happy with that choice ever since. So regarding my home life, my husband and I did not have children right away, which gave me an opportunity to really have about 10 years of career experience before kids were even a factor to consider. And interestingly, I took a very large promotion at one of my earlier roles right when my first son was born, and later was invited to be the CEO of the National Association for Healthcare Quality while I was actually pregnant with my second child. And it seems for me that every time there was a big opportunity from a career standpoint, there was also a really big opportunity from a home standpoint and a pretty big life change that has always accompanied that. So those have been very much simultaneous for me, always.
Great. It's funny you say that, because the same time when I was having two kids, and like you, they're a number of years apart. And each time my colleagues would say that I was birthing a child and birthing a new initiative, because always at the same time they would be coinciding. So I can understand that feeling too. And I loved how you described your process of making change, like taking complex things and using stories and messaging to make them digestible. And again, I really appreciate that perspective of change. I had a background in advertising before I came into public health, and I took some of those skills into this because, again, I just think it's so important. As a researcher, I know data is important, but actually the things that we have found shifted policymakers, for example, were so much the stories, because it's the impact on individuals that also counts. Tell me then a little bit more about the organizational and industry change that you made. Just share exactly what that was, and then we'll get into more details of its impact and any challenges.
So when I arrived on the scene at NACU in late 2013, healthcare quality and safety from an industry perspective was in a very different place than it is today. At that point in time, the role of the quality professional was really still rooted very much in compliance and had been edging towards really taking more of a leadership role in improvement. Back in those days as well, there was no such thing, or very rare, that there would be a chief quality officer. And really, the vice president's roles in quality were really just emerging at that point. For all intents and purposes, industry was largely rooted in quality and safety compliance, and director level was about the top of the career arc for people working in this space. Since I have joined the organization, the industry has changed a lot. And we see chief quality officers as a mainstay now. There's a big emphasis on vice presidents of specific functional areas in healthcare quality and safety. And NACU has really stepped into that opportunity to provide structure, guidance, direction, standards for how to set up a high functioning quality organization, how to think about the full spectrum of competencies that need to be deployed in a high functioning healthcare organization that's really pursuing excellence. We've also taken steps to make sure that not only are we defining the competencies, but we are helping organizations understand how they should structure and organize their teams and really optimize the contribution of the individuals working in quality through continuous professional development, through coaching, through career pathing and development opportunities there. The market was changing a lot, and NACU has evolved with that. And one of the favorite quotes I have from a board member of mine goes like this. She said, NACU lives at the intersection of preparation and opportunity. And for us, that has all really been driven by the changes that we have seen in the market.
That's fantastic, because it's such a good example of more than a mindset shift, right? Because we are in businesses, we're trying to make these big mindset shifts, say, for example, to inclusion or to a healthy workforce. So you're moving from this mindset of compliance, what can we do to meet the minimum, now to how do we actually improve the processes we have? And I think it's great, the things you described, which are you need skills, different skills, you need different structure of your team, and you need whole different career path. Almost the whole growth and career development mindset has to change. And I find this such a fantastic example, because I've learned a lot of my science and what we call implementation science, also from the healthcare field, because when we're trying to put new recommendations into medical care, understanding the workflows, but also then really understanding that to make quality improvement, you have to have very clear learning cycles, and you have to also do it as this, what we often call a peer learning process, because unless the end users of whatever is the new recommendation and the new workflow are involved, they won't deploy it, they won't implement it if they haven't been involved in the process. So I think it's so important that people can hear it takes a lot. Again, we have these frameworks about how do innovation spread, and it's just more than this mindset shift. It's not just compliance to quality improvement. It is all the other structural pieces, the communication of the new initiatives. So tell us more of those details so people can really relate to this big shift and what it takes to do it.
Yeah, so I think to encapsulate what you're saying, we're talking about shifting from compliance, of this notion of compliance, to the notion of excellence that is sustainable at the system level. And so when we think about how we're going to do that, I think we need to look backwards, and mostly we need to look forward. So the good news is that we have been setting standards and rules and regulations for many decades about what needs to change in healthcare. That's all the compliance related components. And even made some aspirational statements that really drove us towards the triple aim and the quadruple aim. That being said, the opportunity today is to focus on how to meet those standards, because we're actually not as good as we need to be at even compliance related standards. And we have a long way to go from the excellence perspective. And so when we think about that, we think about that mind shift from we need to move from the what to the how. And NAECU has really created this framework, which is expressed for us in a wheel of 8 domains of quality. So first things first, there has not been a clear definition, a universal definition, validated definition on what quality is and what the scope of the work is to be. And so NAECU did that. In 2018, we developed the framework, which identifies 8 domains of quality, 29 competencies, and 486 skills that express the work that should be done in healthcare quality to really make sure that, number one, individuals have the career path. So we stratify that against foundational, proficient, and advanced levels so they can see a path forward. And the same tool really gives healthcare leaders a bird's eye view into the full gestalt of what needs to be covered across all levels and contributions for quality. And then we assess on that. And so we can assess individuals, and we offer an organizational assessment as well to really help them understand where they are and set targets on where they want to be so that they can then achieve those targets. And the end result is really building team capabilities and capacity to achieve all of the ambitions, all of the what items that we have outlined for so long in healthcare quality. It really gives us the capacity to achieve those goals, and I think to even surpass stated goals that are out there today.
Thank you so much. And yeah, absolutely. Speaking my own language, I've been developing a leadership course based on behavior change principles. And unless you have that framework from which you can reverse engineer into the point of actually saying, these are the 400 skills you need. For me, it's here's the couple of hundred behaviors you need to do. I think it's so important, that process, not just the here's where we want to get to reverse engineering down into the actual details, but then the path to back up, to be able to see, okay, when I do these skills, when I learn these new things, I'm contributing to this total vision.
This is not achieved top down, and this is not achieved bottom up. Both are required in order to meet the goals that we have ahead of us.
Great. So tell me some of the examples of the impact this has had on your organization, but also then particular individuals that have just felt so supported by this new framework and these new career opportunities.
Yeah, this is one of my favorite things to talk about because it's had such an impact in the industry. So a couple of examples would be, first of all, just defining the healthcare quality competency framework has given people who work in the space of quality something to reflect on that they identify with. So they are viewing their work now within a broader context, and they see themselves in the work. And so they feel recognized and they feel valued. I remember the first generation of the work that we did in the competency space, we actually had printed a book, is how the first set of competencies were expressed. And when we did that, we heard stories of people who went in and dog-eared the pages and highlighted different elements of the skills and the behaviors that we had written down. And they were taking it into meetings and saying, this is what I do. NAECU wrote it down, and it is important and it is valuable, and here's the contribution I'm making. And so that was one example from the early days. And we still see that a lot, that people are grabbing onto that. Many times I will have Zoom calls with individuals or whole departments of quality, and they have the wheel behind them. They have it printed up and they show it to me and say, we're aligning to the standard, we're doing it the NAQ way. And so I think it has really supported them from a rally cry perspective. Another example would be in the work that we're doing with organizations. So when we work with organizations, we have an actual deployment methodology that has a name wrapped around it, which is Workforce Accelerator. In that process, we help organizations support individuals to reach their fullest potential as contributors to the healthcare system. And as we do that, we hear lots of stories about individuals who have said, now that my organization is deploying Workforce Accelerator, we have a center of gravity for quality in this organization. And it is clear to me that my organization cares about quality and safety from a patient perspective. And it is also clear to me that they care about me as a contributor to quality and safety, and that they are investing in my professional development and really helping me see my path forward. And not only that, but it's helping really grow people into new and exciting roles for them as individuals. And it's supporting organizations because now they have a way to handle things like turnover, succession planning, and other HR related items that come into the mix when you're deploying a team of individuals within a system. So many great points of feedback that are coming in, not only, as I mentioned, from the organizational perspective, but individuals as well. And so again, it's just more evidence that this isn't achieved just top down or just bottom up. It has to be both of those really strong contributing factors.
I love that. Yes, because that infrastructure is so important. So like you say, there can be the spread and the sustainment of it as well, because it's very clear where it is. But I think I really want to call the audience to some of the things you said about when people see this vision and when they see the details. One, it helps give them a purpose. There's something that they're working towards, which is so important for employee engagement. Two, there's values alignment there. Those are the values that they also appreciate. And again, we know that lack of purpose and lack of values alignment, these things lead to burnout. And so this is the opposite. You're creating engagement from these things. And then I think finally, the thing that really struck me there about what you said is recognition, because again, we know that lack of recognition leads to burnout. Now, this is not like reward, this is recognition. It's a different thing, but it's so important because, as you say, people see that what they do is important, and also they see themselves in this role, and their role is being recognized and, like you said, valued. So I think it's so important when we think about recognizing people and rewarding people. Often companies start to go, I can't afford that. But there's recognition in simply having alignment, very clear values and very clear alignment of values, and somebody saying, I contribute to this and I am important in this process and therefore I'm recognized. I think that's such a great example of the impact that can have.
I totally agree. And I think that when we talk about recognition, we probably need less pizza parties and more rally cries and really helping people understand that they are part of something special. We can't do it without them. And that as masters of their craft, they're helping solve for really important issues. I think that when we think about things on a day-to-day basis, that's where a lot of the burnout can occur, especially in healthcare, where there's a lot of challenges that are experienced over and over, some controllable, some less. But I think that we can experience burnout at that level. But when we are achieving or aspiring to achieve something that is aspirational, that's really what keeps us going during the hard times. So it becomes this notion that it is hard, but we can do it. Right. And that not only can we do it and should we do it, but the world will be a better place if we do, not only for us and for our families and friends, but for generations to come.
And there's a clear pathway to do that. I love it. More rally cries, less pizza parties. But that takes me then to really think about, how did the timing of this and how did this change to quality from compliance all fit into the COVID epidemic? Because essentially we were at that point where there was suddenly a whole bunch of new rules and a whole bunch of care that we were totally failing to give. And so, yeah, what was the experience there in relation to this, or what was the timing of this in relation to those challenges?
So quality and safety as a profession and as a discipline had been evolving for quite some time, but I would say rather slowly. Each system was developing their own quality processes, methodologies, standards, structures, job descriptions, anything that would go into that mix on the fly at a local level without the benefit of a standard. It was very isolated. When COVID hit, NACU had already made a lot of progress with defining the competencies, and people were really starting to gravitate in our direction and embrace what was there. And so when COVID hit, we had a huge opportunity to really step into leadership roles as quality professionals, as the profession of problem solvers. So if you know anything about healthcare and quality, you know that when things go wrong, a quality professional is almost always brought to the table. And this happened during COVID as well. So when the incident command centers were being established, a lot of times there were quality leaders at the helm and in contributing roles. They were the ones who were helping to stand up the triage tent cities that were going to take on the COVID patients. They were the ones who were helping to re-engineer and redesign workflows to accommodate telehealth, to figure out how to increase the offerings of behavioral health services. So the quality leaders there were really taking an active role, and I think in a very positive way asserting themselves, so that when we get to a steady state with COVID and we have a lot of the challenges that we have today, which are around capacity management, workforce shortages, throughput issues across the continuum of care, financial challenges, needing to eke out waste from the system and make the margins more positive. What you see here is that we have an opportunity to call on those quality professionals again to solve these challenges. So I think that the silver lining of COVID for this profession was that they got to stand up and stand out and be recognized for the problem solvers that they are, because, you know, of a tough time, we were able to really show what we've got in terms of being able to advance the profession.
Great. That's perfect. Wonderful. So what are some of the biggest challenges that you still face, and what processes do you also use to overcome them? Because I think that's what's so important about this, that you understand how change happens and all the parts, the moving parts that need to be in place.
So reducing variability in healthcare delivery is one of the most important things that we can do, because with that, we'll have more predictable outcomes. And I think that as much as we focused on reducing variability in healthcare delivery, we have not given nearly the amount of focus that is needed to reduce variability in healthcare quality competencies and roles and structure within organizations. And so I think that in a go forward situation, the time is now to get set up and situated to do our best work in healthcare quality and safety. I think that it is really positive that organizations are embracing the NACU standard, the NACU way, and that we need a lot more of that a lot faster. There are a lot of organizations who are still struggling in a DIY model to figure this out, like I said, on the fly at a local level without that benefit of that standard. And what we are really driving towards is industry-wide alignment towards this standard, so that we see the reduced variability as I shared. I also think that's going to make the systems much more sustainable. When you have job descriptions that are all over the place, not only at your own organization, but across an industry, it makes it really hard to plan for turnover and succession management and things like that. So having those leveled standards that really are the foundation that the industry can trust and rely on, stand on, is really important. And I think that is the key to the next phase of what needs to go on here from advancing healthcare quality and safety.
Great, thank you. So how many times do you still maybe face people that say, I don't know what to do? Because I feel like we're facing that in other areas of workplaces. They say, I don't know what to do to help my employees with burnout, or I don't know what to do to increase diversity, equity, inclusion in my organization. I feel like that's still an answer we're getting. And yet there are very clear standards out there. There are very clear playbooks and guidelines. So what is it that makes people shift? Because I totally understand that people can be in great intentions for a long time and never actually move into action. So what's been your experience of leading change and really making change happen?
I think it's always important to start where you are with what you have. And so from the perspective of moving things forward, that is where I start. And I think that starting where you are with what you have really helps you to understand the context in which you're working in and what is possible, and it gets you going. And you may not get to that full desired end state right away, but you start to make progress. And I really think that's where the continued process improvement really comes into play. I think if people are waiting for the perfect time or for all the stars to align, it's absolutely never going to happen. And so we need to do the best we can with what we have and start to make a dent in that. And so I think that your own personal accountability and taking the initiative to be the change that you want to see is very important. And if you are not in an authoritative leadership role, I think engaging people who are is really important. And not just saying to them, hey, I think you ought to advance issues in burnout or equity or whatever the important topic is, but to demonstrate to them how you can help and how you can move things forward, which will not only be a relief and a support system to the leaders, but it will also begin to plant the seeds for your own opportunity and professional development.
Great. I love that. That's such good advice. Exactly. Do you have any other advice for leaders trying to lead change?
I think being resilient is very important, and being really self-aware about the different ebbs and flows that you will personally experience from an emotional perspective as you are leading an organization, and particularly leading through challenging times and change up to and including innovation. So I like to reference the W curve, so that you can start, when you start working at an organization, you're really pretty high on the top of that W and feeling great about life and all the things that you can accomplish. And slowly but surely, it's really inevitable that you're going to get to a valley in that W and then need to climb your way back to maybe a midpoint, and then maybe you slink down again on that W. What I have experienced is that the W goes on forever, and that it is important to not only acknowledge things when you're in a high tide, but to acknowledge things when you're in a low tide. And I think it's as important to know what you want as it is to know what you don't want. And sometimes you only figure that out when you're at the bottom of your W curve. The way really getting out of there is to be resilient and to accept every point within that change curve and embrace it and learn everything you can from that, and try for more highs than lows if you can.
Great. And just in terms of, this is a very challenging job. You're clearly dedicated to this and a leader in this industry. So how do you manage your work and home demands? Let's say we're home life, not just with the kids, but just how do you manage from a leadership position that you're in? What are ways, tips that you can give to other mums to manage this sort of situation when you are a leader of change and all the challenges that has? Then how do you go back home and get the resources and support that you need there?
That could be a podcast in and of itself, but I'll do my best to answer that question. I think that it's all about trying to find your purpose. And so for me, my purpose is helping organizations thrive and helping individuals thrive. And I really feel like my job as a mom is to help my kids thrive and to help position them to be successful and high functioning adults, and make sure that they have all the love and support and resources that they need to do their best work in life someday. And that's my goal at work and at home. And then in terms of the resourcing, I think that really having the right resources at work who are helping you to achieve what you need to achieve and to support you is very important. The I can do it all by myself mindset is not one that a CEO can ever have. And so I think that knowing where those resources are and how to activate them is really important, and also never done work, right? So it's something that you always need to work on, and as a leader, setting boundaries and things like that, and also making sure you have the right team members around you. At home, it's also important to have a good team. And so my husband is a great teammate, and we really do a good job of dividing and conquering and filling any gaps that either of us have from a parenting perspective, whether that's availability or stylistically complementing each other. So having a good resource at home too is really important. And then also too, for me, I let the kids know that they are part of the success that I am achieving at NACU, and that they're helping change the world too. And that as they give up some of their mom, what they're going to receive as a benefit is better healthcare for all of us someday. And that will affect their families, and that will affect their friends, and it will affect the world that we live in. And so we talk very openly about that, and they know that they are part of Team NACU as well.
Oh, thank you so much for that example. I've got goosebumps. It's very inspiring because, again, I maybe don't do that as well as I could. My kids know that I'm trying to help other mums with burnout, but I don't think I've really tied it to them that some of their loss is actually tied to me trying to create a world where both my son and daughter have equal pay and equal promotions and other things. So I think I could do better at that. I really like that example. And I have a kind of harder question here, maybe. And it just ties in so much because quality improvement and self-improvement. How do you help either the organizations, or I'm thinking about this a little bit more in an example of my son. He is totally on this self-improvement kick, which I so admire, but it's not coming from a place of I'm already good enough. Have you any, just because I'm sure that's often comes up as a challenge either with the kids or with employees or organizations. How do you help people get to a place of improvement where they already know they're enough?
Wow. So I think there's a lot rooted for me in that question around confidence, right? And feeling like you are important and that you are making a big impact. And so I think that anything that we can do to build our own confidence and also to help build confidence of those around us is really important. And the notion of self-improvement, I think anyone who has big aspirations is always never going to be satisfied. And I think for me, I continue to try and acknowledge and celebrate and be happy with the accomplishments that I have made as an individual and for NACU as the CEO of this organization. And I know that we're not done yet. And so I think that it's very much the difference. Simon Sinek, if you follow him, has written many books and is great on the speaking circuit. And it's the difference between the finite game and the infinite game. So I guess I would say if you're looking at the finite game, right, there's winners and there's losers. It's very black and white, cut and dry, yes, no, wrong. If you're looking at the infinite game, says we have a long runway and the goal is not to win, it's to stay in the game. And how do you stay in the game is you keep up with what's going on around you and always seek that continuous process improvement. So that would be my advice.
I love that perspective and that analogy. Yeah, it's continuous process improvement.
Yeah. I would also say too, from a mom's perspective and trying to navigate that balance between what you're giving your kids and what is left behind in terms of when you leave the house and to go out and run your day and run your business. That one of the things I've learned is that my kids benefit from seeing that too. And that there are things that they experience that are not even visible to me at the time that they experience them. So sometimes as parents, we give things to our kids that we're not even cognitively aware of. And I have an example for you. A few years ago, about 4 or 5 years ago, I was going through a really challenging time at work, and we were making some major transitions into a new physical space and relieving ourselves of a lot of contractual obligations with a parent organization, et cetera. And during that time, there was a lot of stress in our lives. There was a lot of confusion about what would happen next with NICU and how would we get to this next level. And there was some conflict as well in terms of trying to work through some challenges and making a shift. And so my son, Sam, my oldest, had been observing this, and he was about 8 years old at the time. And we had went away for a weekend, and we were waiting outside of this restaurant to have breakfast. And it was about an hour wait. And so we're kicking dirt, just waiting for it to be our turn to go in and have breakfast. And he looked at me and he said, "Mom, I love you." And it was exactly what I needed at that moment in time. And I said, "Oh my gosh, Sam, I love you too. That was so great. Can you just tell me why?" And he looked at me and he said, "Mom, come on, you know why." And I said, "Just please, my cup is empty right now and I just want it to be filled up. And do you just have one word, just one word? I'll take one word if you can muster it." And he said, "Okay, fine, stand up." And I said, what do you mean stand up?" And he said to me, "Don't you know what stand up means?" And I said, "I know what it means to me, but I don't know what it means to you." And he said to me, "You do what's right no matter what." And it was amazing. It was an amazing experience to see that he had been watching all of these things play out. And he knew of me that I would always do what's right. And I wasn't going to quit and I wasn't going to give up until the job was done, the task was completed, and that I would do that in the best way for everybody. And so that was a big mom moment for me, because I realized that they are picking up on things and behaviors and traits in us. And then they get the opportunity to watch that and to grow themselves through watching their parents grow.
Thanks so much for listening today. I hope the podcast brings you fresh ideas, renewed confidence, and energy to keep leading change. If you need a partner in these efforts, I can help you effectively build a thriving workplace culture for all. I'll help you overcome the real barriers to change you face every day and help you lead real change with evidence-based solutions. In particular, I want to work with passionate leaders who have tried and failed, because I know you have what it takes, and your experience will help you clearly recognize the difference I can make. For a free consultation today, please visit my website at www.leading-real-change.com. That's www.leadingrealchange.com.
Take control, you're a fighter. Push the limits and see it, you're already there. Told you we going higher. Ain't no stopping us, we're going in for the win. And we're gonna celebrate. Then we're gonna do it all over again. And we're gonna rock this place, 'cause this is our day. We're gonna do it together, through any weather, rain, sleet, storm or hell. We're gonna prove it together, move it together. There's no option to fail. We're gonna do it together, through any weather, rain, sleet, storm or hell. We're gonna prove it together, move it together. There's no option to fail. Close your eyes, feel the power.